Hello, everyone, and welcome to our last episode of Pahinga. And actually, the last two episodes, I was a replacement for someone from the first episode, but now I have here someone new, someone we have replaced Zandy, but it's okay. The show must go on, as they say. So, hi, Gail. You wanna take it a little
Hi.
bit back from the previous episode. Even if she wasn't there, she still know what was going on. So Gail, you wanna explain a little bit about our previous episode?
Yeah, so last episode, we got a little bit technical about peer support with mental health. And syempre, it got a little heavy. And some points were very interesting to talk about with Tita Vey.
Yes, of course. See Tita Vey, very interesting character, very interesting way of talking. She was very specific with her examples. She gave a lot of different ways to know how to know if a friend needs your support, your social support, if your friend needs to get the professional support that they need. And marami talaga ako natuto from the previous episode. And she also had examples from Shopee. So it was very relatable. There was also about K-drama. So I'm sure that everyone watching it now in our fourth episode that the last episode and the previous episodes even before that are all episodes worth watching. And
Yeah.
yeah,
And kung napapansin nyo ngayon is medyo nagpa-beauty kami syempre ni Rafi. Kasi ito lang last episode ng podcast na ito. Syempre, we wanted to end the show with a bang.
and yes, of course, let's get introducing ourselves na, Gail, no? So, hello everyone, ako si Rafi.
And ako naman po si Gail.
At ito ang Pahinging Pahinga, isang serye ng mental health video podcast na nagnanais makatulong sa mga nakakaranas ng mental stress ngayong pandemya. Hello listeners, everyone, listening to the live on Facebook, listening on Spotify, or listening kung saan man. Thank you so much for tuning in, for listening to our podcast.
Yan. So, ang pamagat ng episode natin ngayon is Hard Times, Mental Health Situation in the Philippines amidst the pandemic. So, ako nga personally, na-experience ko talaga since nung start ng pandemic. As an extrovert, hindi nakakalabas, hindi mo physically nakaka-interact yung mga friends mo and family mo. Sobrang hirap na gantong setup, di ba? Ikaw, Rafi.
Exactly, Gail. Ako rin, I feel you so much extrovert din ako. Sobrang talkative ko dati. Tapos parang ngayon, nandito lang ako sa labas, hindi ako nakagawa na masyado, ang dami kong academics, ang dami kong pinoproblema. Pero ayun, nandito lang ako sa bahay, wala akong support sa mga friends ko, chat-chat, puro chat-chat lang. So, you can only do so much to help your own mental health. And I'm glad that we have a speaker here today to be able to address us. So anyway, before we introduce our speaker, kadalasan ang talakayang pang mental health ay nakasentro sa kung paano natin maaalagaan ang ating sarili at mga kakilala, ang katotohanan ay bilang isang pambansang krisis, malulutas lang natin ang krisis pang mental health kapag tayo nagkaisa para sa pagbabago. Kaya naman tatalakayin ng ating tagapagsalita ngayon ang estado ng mental health sa bansa at paano natin malalabanan ang krisis pang mental health bilang isang sambayanang Pilipino.
Ang episode na ito ay hinahandog ng Power Up Team 6, isang inisyatibo ng Rise for Education Alliance UP Diliman. This episode is co-presented by Sinagdiwa Volunteers for Mental Health Awareness, and Changemakers Philippines.
And it was also created in cooperation with We Mind PH, Alliance of Public Health Advocates, City of Mandaluyong Science High School Supreme Student Government, the Philippine School, Dubai Senior High School Student Council, Yugto Philippines, Likas Bayan Organization Incorporated, and ang Angkla PH.
Special thanks to Aksyon ng Kabataan Organisasyon.
Kaakibat naman ng layunin naming matugunan ang mga suliraning may kinalaman sa mental health, kabilang sa mga benepisyaryo ng podcast. Ito ay ang Youth for Mental Health Coalition. Ang Youth for Mental Health Coalition ay samahan ng mga organisasyong estudyante at kabataan na naghahangad na paunlarin ang kamalayan ng bansa sa mga isyong pang-mental health. Ang unang SEC-registered na non-profit organisasyong pang-mental health sa Pilipinas. Malawak ang sakop ng kanilang nagawa laban sa krisis at stigma ng mental health. kagaya ng tumulong sila sa pagtitipon ng suporta at sa paglilikha mismo ng Philippine Mental Health Act.
Para makatulong sa kanilang mga programa tulad ng educational discussions, forums, at pag-i-institutionalize ng usaping mental health sa lipunan, maaaring magbigay ng donasyon sa GCash account ni Hazel Grace Romero na may numerong 0995-465-6448 o di kaya sa kanyang BPI account na may numerong 981-941-3131. Tatanggap kami ng donasyon hanggang 1 ng Mayo 2021. Ang mga numerong nabanggit ay makikita sa inyong mga screen.
So yes, don't forget to donate, guys.
Yeah, tama.
So, ayun, we have our speaker today. So, without further ado, let's get to introducing our speaker. So, ang ating tagapagsalita ngayon ay isang rehistradong psychologist, research consultant, program designer, mental health advocate, lahat-lahat na, at global mental health scholar sa ilalim ng programa ng King's College London at London School of Hygiene and Tropical Medicine.
Dr. AJ Sunglao is a mental health advocate and licensed psychologist from the Philippines. His work as a psychologist and a consultant involves designing and implementing interventions within the healthcare development and advocacy sectors, both locally and globally.
And of course, his focus is on developing systems, policies, and interventions for more accessible mental health care in disadvantaged communities. He is also currently a scholarship recipient at the London School, London na naman, for Hygiene and Tropical Medicine for their Global Mental Health Program.
Pinakikilala namin si Dr. AJ Sunglao. Yan. Hi, Doc.
Rafi. Siguro unang usapan muna, kasi baka pagalitan ako. I'm not a doctor, by the way.
Hi.
Not a
Of course,
doctor.
you can clarify that. Not
Not a
Dr.
doctor.
AJ, it's just AJ.
Yeah, this is AJ.
It's just
Yeah, is fine.
AJ Sunglao.
So thank you, Gail. Thank you, Rafi, for the introduction. And thank you then for all our partners for really supporting this kind of initiative. Dahil nga, ang laki ng usapan ng mental health ngayon. At tama lang na ating palalinin to dahil nga, hindi pa tapos ang pandemya at hindi pa rin tapos ang bigat nating dinadala dahil dito.
So before we continue, before we start asking you questions, would you like to say anything else, anything more, before we start getting into the meat of the
Yeah.
actual podcast?
Siguro, and this is something I'll probably touch on naman talaga sa ating usapan. Pero ang usapan ng mental health ay madalas nababagsak sa usapan ng individual. Pero kaya natin tandaan ang usapan ng mental health ay hindi lang tayo mag-isa pero bilang isang komunidad, bilang isang populasyon. And madalas itong nakalimutan dahil nga sobrang lakas ng kwentuhan about resilience of the individual sa Pilipinas. Pero resilience, ika nga ni Dr. Sandra Galea, ay usapan of an entire population. Dahil mahirap maging resilient kung isipin mo ang isang kawayan na inaanod o gustong pabagsakin ng hangin ng bagyo. Pag ito ay mag-isa lang, pwede itong maging malakas. Pero mas malakas to kung ito ay napapaligiran ng iba pang mga kawayan, tulad ito, na kaya maging resilient kasama niya. And mahirap ito dahil nga, pag wala tayong polisiya, wala tayong pang-support na talagang pangmaramihan, may mga napapang-iwanan talaga. At yun yung nakikita natin ngayon sa estado ng mental health. Talungan ang mental health ngayon ay mostly private services. At ito ay mostly out of pocket dahil ang mga insurance na types of mental services ay hindi pa ganun ka-common o hindi pa para napabunas para sa lahat.
So ayan, thank you for that, AJ. We should, of course, be able to keep that mindset with us while everyone here listens to us, because it's very important to be able to be critical of how we perceive mental health, especially now during the pandemic. And so I'll be heading on over to our first question. So of course, nasa pandemya na tayo, AJ. So paano nagbago yung kalagayan ng mental health natin sa Pilipinas since ito na yung state natin sa Pilipinas, pandemic na tayo. So what's happening? What is the state of our mental health now? How did it change?
I think in the Philippines specifically, ang pinakamalaking nagbago ay yung awareness on it. Dahil nga, although we have had the mental health law since 2018, it's only in, I think, early 2020 na nalabas ang mga guidelines on mental health in the workplace, mental health in the public sector. I know nagkakaroon din ng plano for mental health in the schools. Pero tumama ang pandemya. So nasa punto na tayo na may mga taong talagang aware sa mental health. Ano ba to? ba to importante, pero hindi ba to talaga nabababad sa lahat. Pero nung dumating yung pandemya, naramdaman natin to dahil nga diba, unang nangyari ay nagkaroon tayo ng quarantine, ng ECQ, isolation, like, what similar to what we experienced in the past few weeks. At yun, naramdaman ng tao yung hirap at mas naging self-aware tayo. At dahil nga people are at home, are online more, mas na-reach nila yung mga resources on mental health. So, mas naging common din yung usapan, mas lumaki yung awareness. Pero, ang naging challenge naman doon ay, malaki nga awareness, pero na-access ba natin yun? Na-access ba nila ang mga serbisyong ito? So, nagkaroon ng parang yun, dagdag sa COVID, yung takot sa COVID, may term nga tayong COVID anxiety, COVID fatigue, na lumabas dahil nakatakot diba? Magkasakit, baka mahawaan mo mga kamag-anak mo, pamilya mo, mga mahal mo sa buhay, baka magkasakit ka. At the same time, yung mga issues sa ating lipunan na kawalan trabaho, kahirapan, late na ayuda, ang daming mga bagay na talagang nagpapatas na sa stress. At dahil nasa oras tayo ng pandemya, sa oras tayo ng kahirapan para sa karamihan, mas lumalaki lang ang ating risk para sa mga mental issues na anxiety, yung takot. At ang hirap na usapan tayo dahil nga mas marami, may mga very argue na mas importanteng pag-usapan kaysa ang mental health mo. Lalo na gutom, lalo na ang sakit, ang physical health mo. At to an extent naman, may punto sila. Pero hindi natin pwedeng kalimutan na minsan nagkakasabay-sabay ito. At minsan nag-stack-stack to na na dahil nga tayo na sa punto na tayo sobrang agit na, sobrang anxious na nahihirapan tayo na makita kung ano yung mga, parang paano natin tutulungan ang sarili. At lalo na tutulungan ng mga kasama natin sa ating bahay dahil nga ang anxiety minsan ay nakahawa. And this is why naging common din nga yung mga in mental health talks before na about stepping away from the news or from social media dahil sobrang nakadagdag lang to ng yung mga news about gano'ng kami namamatay, gano'ng kalala ang pandemya. Parang just worsens this. So, in a sense, naging makalat siya. But at the same time, nasa punan tayo na may awareness na and people are looking for ways to support themselves. Pero kailangan natin intindihin na meron din punto na habang ito nangyayari lahat, habang ito inaalala nila ang pandemya, ang kabuhayan nila, ang pamilya nila, at of course, ang kanilang sarili.
Yeah, and since you mentioned, there are lots of things that they have to worry about, all these people. On the other side naman, since it's a pandemic, it's COVID, there are lots of factors that are worsening our mental health. So, paano naman yung COVID infection rates, yung fear of COVID, yung isolation due to the lockdown, and yung massive unemployment crisis? How has it affected our own mental health problems? And how many people actually receive the support that they need for their own mental health?
I think, siguro with as I mentioned, magkaroon tayo ng bagong term, which is called COVID anxiety, na talaga yung anxiety natin regarding COVID, whether it's getting sick, the fear of getting sick, the irrational belief na baka lumabas ako ng bahay may mangyari sa akin, and ang daming bagay that stacks to it. And nag-overlay dito yung stress din talaga on managing our needs, dahil na kung kayo ay nawalan trabaho o napektuhan ng negosyo niyo dahil sa pandemya. So, ang laking kabigatan nito. Dahil nga, diba, parang, and this is a common rhetoric. When yung sa mga balita, narinig nyo na ba't lumalabas ang mga tao kasi kailangan na kumayod, kailangan na kumita. And, hindi naman porque inisip nila yun, wala na silang mental health concern. Hindi na sila takot sa COVID, hindi na ito inaalala. Dahil, kasama pa rin yun. Parang dala-dala pa rin nila yan kahit saan sila pumunta. At diba nga meron tayong Maslow's hierarchy of needs.
Yes.
And kahit arguable kung saan mapupunta ang mental health sa hierarchy na to, kung saan siya pinakauna, pero alam naman natin, diba, yan, mga pagkain, housing, tubig, lahat yan nasa pinakababa, pinakailangan natin matamaan. At minsan nga dahil ngayon yung naapektuhan din ng COVID, ng pandemya, doon pa lang, ang laki na agad ng risk factor na na-expose ang ating mga kababayan. Generally, known naman ito sa buong idea ng mental health na poverty ay sa mga pinakamalalang risk factor ng mental health. Isa sa kung bakit ang daming nations sa buong mundo, naming tao sa Global South, yung pinaka-term, ay talagang at risk for mental concerns. Apart from the other issues that come with mental health in a Global South situation. Regarding on how many actually receive support, mahirap masabi yan. Dahil nga, yun nga, merong numero na binibigay ang SMEs regarding emergency services nila sa kanilang hotline. Meron tayong in-touch hotline, and may mga certain clinics tayo na nag-offer ng pro bono services. Pero may masabi dahil dito consolidate. Ang ating siguro masabi lang ay karamihan talaga ang dinakuha ng serbisyo ay ang pinakamahirap. Kasi isa sa mga hirap ngayon sa move ng mental health in the Philippines, we went digital. We went online. And malaki pa rin ang risk for people na paano kung hindi sila makapag-online or paano kung yung online na oras nila or yung opportunity nila to go online is limited dahil nga their own data, they have to save it to go to school. So may mga bagay na gano'n na kailangan din i-take to consider. Kaya, mga intersections on poverty and mental health na talagang napapalala ng pandemya ngayon.
Follow up to dun sa kanina na mention nyo na naging topic na, malaking topic sa atin, yung from moving away from the media, moving away from the news, if you want. Paano sa tingin niyo po, gaano po ka-effective yung pagsusokmed detox, when you're not really feeling good, you should move away a little from the news, gano'n. Gaano po sa tingin niyo ka-effective yun?
I think it can be helpful, pero syempre, it's a balancing act kasi I do honestly believe that completely taking away news specifically is in a long-term bad kasi we have to keep ourselves informed, lalo na when it comes to a crisis like this. And lalo nga na when updates regarding the pandemic happens on a weekly, sometimes even daily process dahil nga sobrang daming nangyayari. So, important ko malaman, lalo na, let's say, if something happens, let's say, if you need to go to hospital, if you need to, let's say, magbayad ng SSS, magandang bagay, you have to be informed. Pero, overall, I think it's effective na it's been pretty, parang actually, it's, for a lot of my therapist friends, a lot of them have been prescribing this kind of detox na, baka stay away from social media after, let's say, 7:30 p.m. or 8 p.m., depending kung anong balita pinapanood mo. And that was it. Kasi what we want is also to help basically build space for ourselves. A space na talagang kaya natin mag-recover kasi one of the things this pandemic does do to us is it changes how we recover. And diba, you mentioned you're extrovert, so am I. Iba yung recovery Parang yung iba ang kate ng not being able to hang out with friends, to chill with them, to talk with them, to just, mag-online Zoom tayo, mag-online inuman tayo. Iba yung tama pa rin. At iba pa rin yung parang tanggal pagod na ginagawa nun. So, we had to parang find what's the most effective thing for us right now. And for some people, it could just really be lessen the amount of stressors that you can experience. Or self-lessening it. Use that time para mas may gawin kayo na mas purposive na nagpapasaya sa inyo. Magbasa kayong libro, spend time with family, mag-crochet kayo, mag-alaga kayo ng halaman, whatever. Parang, and this really on taking your recovery to a more purposive stance. Kasi pag hindi, parang you're gonna be floating, and dahil nga the general state of the world right now is negative, it will at some point affect you, even if it doesn't directly, kahit wala nag-trigger sa'yo.
So yeah, since you mentioned that, I think it's also important then to recognize how everything that's happening to us, everything that's happened to us the past year is all new to us. We're all lahat tayo nagkakapa-kapa sa kung anong pwedeng gawin, kung ano kailangan gawin natin para sa mental health natin, para sa own health natin nga actually. So even myself, I still find it hard to be able to cope with academics, cope with my own social life, because pretty much at this point I've realized that you're gonna have to be sacrificing some part of yourself, your mental health, or some other part to be able to do good in some part. So I actually just realized this morning how it's so hard to be able to keep up with academics, especially now. And sometimes you really have to isolate yourself from your friends just so you can focus. And it's really hard how these institutions, how these colleges, how these universities, these government institutions aren't really like putting an emphasis on mental health and putting more emphasis on quote unquote bigger problems like I don't like what you mentioned, AJ, and it's really hard
Yeah.
now, and it's a year later, and it's a little saddening how we're still in this state. So what
Yeah.
about you,
Yeah.
Gail?
Siguro,
Uh,
sorry.
yeah, go
Siguro,
ahead,
sige.
AJ.
Siguro yung sa akin lang na, just to respond to what Rafi said, there's no shame in fumbling in doing something for the first time. And di ba parang, and kasi di ba parang it's your first time, eh. You will make mistakes. I think that's the most sad, that's the harder thing na parang, at least on a more macro level, na parang how the country itself has been responding, that's where it's becoming tiring. Kasi nga, parang the people, diba, we've tried to do what we can. And then, we're still here, so what's happening, and there's no clarity. And uncertainty is cruel. Dahil nga, diba, parang, anong ba gagawin natin? Saan ba tayo pupunta? When will things be okay? Like, a lot of people, including myself, had to, parang, akala ko, pwede na akong masa na, by April, pwede na tayo, okay na tayo. So I booked something local lang just to take a break, take a short vacation, and I had to move that too. And I can imagine a lot of my friends, lalo na nga some people were very optimistic who started booking flights na they had to move in perpetuity kasi parang laging ang hirap ma-disappoint. And 'di ba parang alam mo yung turn down ka lagi. Ang hirap ng ganung sitwasyon.
Mhm.
Lalo nga na when it's something that you've been hoping for. And right now, I would say that it's gotten a lot harder just because and if you're in social media, your feed might be a mess of what you usually have and a lot of condolences, a lot of requests for support. And that's hard. Even if there's nothing harder than what the person is going through itself, yung tao na humingi ng tulong, humingi ng condolences nila, talaga no one can match that. That's not this, but the point is it's not this grief, hindi naman to sino mas mabigat. Di tayo pabigat dito. Di tayo sino ang pinaka nahihirapan, wala kang karapatan. Walang ganun na dito. Ang punto talaga ay it just sucks, it just hard. And kailangan natin i-acknowledge yun dahil that's what we need to go through kasi that's where we are.
Yeah. Ang ganda. Actually, natawa ako. Kasi ang ganda talaga nung makaka-explain mo. And, dadako naman po tayo sa next question, which is, ano-ano yung mga pangunahing dahilan kung bakit onti lang ng mga Pilipino yung talagang nakakakuha ng suportang profesional, and bakit sobrang onti lang na pag-advocate, and bakit sobrang hindi siya tinetelevize in a way yung pagkukuha ng suportang mental health pertaining to mental health, and bakit sobrang hirap nga in a way sobrang hirap na i-research, gano'n. Kailangan mo talaga mag-research to find what you really have to get, gano'n po.
Siguro no, one of course is this goes without saying at this point in mental health is really the shame and the stigma. Na may stigma pa rin on mental health, and specifically seeking support for mental health dahil bad mental health is associated with you being a weaker person, o mahina ka. Dapat kakayanin mo yan. And diba, a lot of us might have experienced that kind of self-talk na AJ, ba't di mo to kaya? Ba't di mo to kaya pagdaanan? Di mo to kaya gawin? And that, ang laki ng judgment agad, especially on ourselves, and that fear of judgment from other people. And lalo nga na if you're in a population or if you're somewhere that's not as open to talk about emotions, and Pilipinas, we're not really, we are a very emotional country. We have emotional languages, pero we don't talk about it in the same way. Ang lakas pa rin ng epekto ng machismo dito, ang lakas pa rin ng hiya in trying to talk about these kinds of things. Sometimes pa may guilt pa nga na yung guilt na why am I feeling this way? Okay naman dapat ako. For example, I'm in a good house, I'm safe, I'm eating well, we're not dealing with issues of poverty. Pero, ba't masama pa rin pakiramdam ko? And that can come with guilt. I think the other part is there's also the issue of mental health being a very personal thing that you go through. Sobrang personal ang issue ng mental health eh. And sometimes it's not something that we're always open to talk about. And that's there's no shame in that. There's nothing wrong with that. But then it also makes it harder for people to just really talk about it in a more open space. Because it requires us being vulnerable to a group of strangers, lalo kung social media to. And that kind of vulnerability takes skill. It takes a lot of strength to build. And it also, at the same time, it also takes an environment. Like sometimes, and this is kind of something that I know advocates have been working on changing, is how do we make our online spaces safer? Kasi, di ba, ang daming madalas nangyari, even to this day, na you try to post something vulnerable to an online space or to even a personal social circle space mo. And sometimes you still get invalidated. Or people don't listen ang sabihin, oh, yung naramdaman mo, oh, why not try this? Baka umokay ka. People are already offering solutions. When in fact, you just want people to acknowledge your emotions with you. Na parang be with you in these kinds of emotions. And yun, ang hirap. The other sides, of course, is it's parang, again, you mentioned it na, saan ka ba makahanap ng mental health services, magkano ba yan, at yung usapan na pangmayaman siya. It's for people who have means, it's a luxury good. And that's, I think, something that's worsened din in a pandemic na, because if people are more, mas kapit sa patalim, mas onti ang resources mo to spend on things apart from your immediate necessary goods, it becomes more of a luxury in comparison. And this is where the intersection of poverty and mental health will also kick in, na yan, dahil nga wala kang pambayad and privatized nga ang karamihan ng ating mental services, na di mo siya titignan as something na, kahit sabihin mo kailangan mo na. Pero we know that bad mental health also affects your economic output, your productivity, your motivation. Kung estudyante pa nga lang ating mental health, hirap na sila gumawa ng mga requirement nila. Paano pa kaya if you're working? And how will it affect you in your performance? And dahil ang taas pa ngayon, diba, ng unemployment anxiety rin ng mga tao because ang taas ng joblessness, ang laki rin ng concern on, oh, we just have to perform. We have to make sure that we have work. Dahil working right now is how we put food on the table. And if that fear is unaddressed, diba, again, basic needs, magutom tayo and paano na tayo, baka mamatay tayo sa gutom. So, ang laki na nag-interplay pa rin. And yun, it's stigma, accessibility, where do we find this? And of course, poverty, which is the first thing, accessibility.
So it's clear that there are lots of problems, lots of stigma, lots of things that cause mental health to become a bigger problem than it could be here in the Philippines. And you've mentioned that it's expensive and inaccessible, but why do you
May
think?
add something din pala. And this
go
is
ahead.
parang sorry na, ang isip ko lang is, part and also of accessibility is, saan ba nakasentro ang mga ating mental health services? And usually, it's going to be in the city spaces. Like, in the past few years, mas dumadami na ang ating spaces within, let's say, provinces, let's say, barangay level, mental health services, nagkakaroon na yan eh. Pero, the majority are still gonna be in city spaces. And, diba, ito yung usapan din na, gano'ng karami ba ang ating kilala na growing up who talks about mental health? It's not something na madalas pag-usapan unless a very westernized or very exposed na yung tao na yon sa issues na to from early on. So it's something that's fairly new for some Filipinos. And reaching it lalo na nga in yung mga nasa laylayan talaga na baka they have zero concept on what mental health even is also an important factor dahil these people, diba, we don't know where the mental health is kasi we don't have the data for it, we don't have the resources to know kung kamusta ba talaga sila.
Yeah, since you mentioned that, I was actually about to ask you why is mental health so inaccessible in our country, and we can definitely pinpoint many problems, and it's very very clear that there are lots of problems, lots of causes for this, and
Yeah. One
I
siguro,
guess
sorry, go ahead.
yeah, go ahead.
Siguro, just to answer that question directly, no, one is of course, onti lang kami, na it's probably 600 psychiatrists and 1,500 psychologists for a population of 100 million. So diba, that's 1:20K. No. 1:50 ata? 1:50K? Tama ba? Minimum. I'll check my math later. Pero that ratio is really bad. And again, majority of them was centered around um, the urban centers, and majority of them then are private. And ang bagay nun, dahil nga saan tayo pupunta? And kung diba, parang gano'n kadalas mababiyahe ang tao para lang sa mental health. Lalo na kung nasa probinsya ka. Like, let's say, kailangan pumunta let's say, Davao, and galing ka ng bundok, or galing ka ng somewhere more rural, somewhere farther to get mental support. It becomes so unwieldy. Sobrang hindi na siya nagiging practical. And diba, if you're low resource, if you need to think about these things, practicality matters. There's also that issue of mostly being privatized dahil diba, parang we need to offer mental support without compromising the mental workers themselves. Kasi diba, parang we want to make the industry sustainable so that people can practice in it. So ito yung nagiging balancing act on what is accessible, what is not. Obviously, kung nasa city ka, mas mahal ang overhead mo dahil mas mahal ang renta, mas mahal ang bilihin, maraming mahal na bagay na mas mahal. With COVID right now, since we went digital, some of these issues have been addressed, and that's why I think mas malaki rin ang reach. Pero again, it's an issue rin on may internet ba yung mga tao, alam ba nila na pwede nilang puntahan ito, alam ba nila na may mga ganitong mura, and usually, pag mura, may oras ba sila para sa akin? Dahil isa naging issue rin is baka mura nga pero ang waiting time mo naman ay napakatagal. So di rin siya naging practical dahil nga minsan nating mental issues ay kailangan immediately ma-address bago tayo lumala. So ang daming nag-interplay din ulit. It's a complex system, pero a lot of things have been affected because of COVID. Hopefully it makes it more accessible, at least because of digitization. Like, overhead is cheaper. Before, let's say, kung 10 kayong tao sa isang clinic, tas 4 ang kwarto nyo, clinic na yun, hindi kayo pwede sabay-sabay mag-consult dahil kukulayan kayo ng kwarto, and it's all face-to-face. But now, if you're doing it from your home, some people are doing it in the clinic, there's a lot more ability to serve people at the same time. Although, dito ka naman pupunta sa usapan na sapat ba ang hours rendered services to cater to the entire population? The answer is likely going to be a no. Dahil napakarami pa rin ang nangailangan. At ang mental health, hindi siya to parang walang magic pill. Hindi naman to one session, okay ka na. Minsan iba to kailangan trabuhin talaga. Kailangan ng ilang sessions bago talagang matulungan yung tao sa dinadaman nilang problema, dinadaman nilang issue. So that's one. Mental health takes a while.
Yan. Grabe, ang ganda po ng insight nyo on that topic. And I think, tama nga, there are many ways and it doesn't have to be one size fits all, di ba po? And next question naman po. So I think medyo magiging tayo, for all ang question na to is, ano-ano po yung pagkukulang ng mga paraang nakalatag sa pampublikong plano para maagapan ang mental health?
Yeah. I don't want to come off as I'm going to just be bashing it. So, pero kasi sa guys marami. Napakarami. And although iba naman talaga dito sakit as a developing nation or nation in the global south when it comes to mental health, a lot of it is still kind of apparent. Of course, some of the shortcomings is accessibility of mental health. We've had the mental health law since 2018, pero yung clarity, yung bigat na implementation nito is something that's on its way. And there was a talk by someone from the DOH recently on this. The mental health law is supposedly a community-based platform for mental health support. And this is what it means is dapat we're gonna go away from we're gonna go away from specialized care, which is some care is often given by a psychiatrist, and we're gonna go to either community-based care or primary health care. And sa ngayon, yung usapan is, andyan na ba talaga siya, yung sagot ng mga tao, especially the people I've talked to, especially even the clients or the communities that I've been assisting the past year is wala pa. We have a program called MHGAP, and it's a WHO system on training primary healthcare workers to better be equipped to tackle basic mental health concerns. And yung ano is, syempre, naging usapan pa rin is gano'n ba comfortable ang ating mga primary healthcare workers in dealing with mental health? And are we able to kind of properly assess kung gaano ka ayos, kung gaano ka galing yung pag-implement nila? Dahil kailangan may scorecard din eh. Kasi we have to be able to see kung saan ba kailangan i-improve ang kailangan natin i-assess kung syempre gaano effective ang care na to. Dahil any intervention needs to be assessed so that we know how to better improve it. On the community-based side, there have been very good local government units, LGUs, that have been doing mga barangay-based platforms for mental health. This one's in Cebu, in Quezon Province. A lot of some LGUs now have been offering services to the hospitals or to the clinics near them. I know Davao, within the past few years, also created their own facility for mental health na rin. Pero, again, diba, yung parang hindi siya, you wanna say it's countrywide pa rin. It's in certain localities, which helps a lot. Don't get me wrong. It's super good that we're there, pero it's not to the same level of community-basedness that we need to. Kasi community-based also implies it has quick impact. It has an impact when you reach it. Kasi I've been doing community-based interventions for the past 5 years. And kailangan talaga ma-assess mo yung may impacto ngayon. And that's something difficult kasi with mental health, diba? Again, the impact might not be sudden, but that's why you need good design. Kasi kailangan ma-design mo ang intervention mo na in a way that it has impacts to the people that are taking it right now. And that's why interventions are really therapy-like. Yung mga interventions to could be, it's a parenting program, or it's, I remember one very effective program is called Friendship Bench. It's in Zimbabwe, if I'm right. And yun, di ba, parang they trained grandmothers to work with primary healthcare workers to provide basic mental health support to people in their communities. And I can talk about this for hours kung ba't magaling siya, pero the important thing is they embedded the intervention within the community and added ways that it could be sustained. And yun yung mga bagay na parang I don't think we're there yet. I know a lot of people, a lot of movements have been happening to change it. There's programs like Masayang Pamilya program, which is, while not a directly mental health program, it's a parenting program to reduce child maltreatment. It has very good it has good effect. It has good evidence for mental health, for term, for mental health outcomes within its program, even if it doesn't directly address it. There's a policy. We haven't really seen how strongly the DOLE and the DILG memos on mental health in public sector in the workplace have been implemented and enforced. And mga mental policies na ba yung lahat ng kumpanya? The answer is likely no. And the answer that companies will likely give is because it's the pandemic. Because they have to adapt to it. And that's fair. Pero kailangan pa rin eh. And again, there's also that, what about how the integration of mental health within the UHE and PhilHealth? Naging usapan na rin yan before, pero again, this time, there has been movements and there has been actions by DOH on allocation of budgets for medicine, for mental health, dahil nga it's one of the things that makes psychiatric care not accessible dahil ibang cost pang medicine. But then, is it reaching the people it needs to? I don't know the best answer for that. But from what I'm seeing, hindi pa rin. So again, ang daming shortcomings pa rin eh. And there has been really good effort for it. But shortcomings are still shortcomings. And the pandemic just worsens them kasi it highlighted the need now. It highlighted na ngayon tao I think there was a PSA article in how 2020 suicide risk worsened by 26% ata. I'm pretty sure Rappler may run that too. Ang daming issue ngayon ng people nga. I think this was Vikram Patel, one of the people in the global mental health space, who talked about while awareness building is something that's important and valuable, when we build awareness, are we able to match it with access to services? Kasi that could create harm eh. We're creating this idea of what is mental health, ano ba yung problema, ano ba yung pwedeng mong magawa para matulungan to. Pero yung means para matulungan ang sarili mo o para tulungan ang sarili mo ma-overcome to ay hindi nabibigay sa'yo. And that just creates frustration, and which now can, parang you're just hammering further into your own struggle. Kasi now it's inaccessible, it's not there, but you know it's important. You know you need to have it. It's something that you should be able to access. So, yun. So, yung dami kong feelings sa topic ito kasi nga talagang it's a topic that we know that has a lot of potential, and ang daming usapan about WHO, about how mental health funding should be prioritized kasi the return of investment for mental health is, I think, 1:4. For every dollar that you spend for mental health, there is $4 that you get back in terms of other aspects of health, productivity, making certain health systems more efficient. Pero ito yung mga bagay na hindi pa talaga napuput into practice. In terms of how can public officials and lawmakers address this, just better budget, better allocation of resources, better integration of mental health into other services. Dahil ang mental health lang naman, hindi lang naman to usapan ng health lang. Diba, as I mentioned, you can integrate mental health into parenting, you can integrate mental health into any kind of social intervention you have. Ilagay nyo to sa loob ng 4Ps, ilagay nyo to sa loob ng iba't ibang mga issues, like put it in your schools. Kasi lalo ng adolescent suicide is one of the top among that age group. So, ang daming mga pwedeng paraan. Pero, it's enough. This where parang lobbying advocacy groups like Y4MH, MHPH, Silakbo PH, all of these groups are really helping, and why we're trying to kind of build these arguments for them dahil the need is now. And yes, there's progress coming our way, pero parang we know that it could be better, and we know it should be better because we've seen how not having services, its impact can really hurt us.
So there, you mentioned a lot of things. No?
Yeah.
Yeah. So it's a little bit to digest. So
Yeah.
just to
Sige, ang ano
remind
kasi
everyone.
number one is DOH is doing a lot of things. And we have, based of the law that we have, there are policies in place in workplaces, even in the public sector. And DOH has been moving to do more training for MH gap, for primary healthcare workers, and also they have provided more access to medicine. Pero it being community-based program, I don't think it's there yet, just because that hindi pa siya talaga in the communities, apart from individual efforts of certain LGUs to create mental health services for their communities. In terms of going back sa issue ng shortcomings, ito nga, parang these gaps in terms of research data, monitoring and evaluation, dahil we don't know what's effective, and also its lack of integration into existing services, dahil we don't have to recreate the wheel when we do mental health. Sometimes, kailangan siya isama as part of the outcomes or as part of the design of certain other interventions, and that could be enough. And this is just hard now kasi nga, people are aware now, and it's harder because they also know that we're aware, pero nasa na ang tulong. Diba? Parang it's Plato's cave na you know the light's out there, pero you're trying to access it, pero there's no way for you. Parang may resistance stopping you from accessing it. And that just builds a lot of frustration, a lot of resentment. That can actually be detrimental to you taking care of your own mental health in the meantime of not being able to get these services that you need.
So of course, there's a lot of different perspectives to looking at mental health, and thank you for summarizing your concerns and all the things that you wanted to say about these institutions. Yeah, right. And like I said, there's lots of ways to look at it, and we can look at it from an individualistic sense, from a very social sense, and of course, discourse surrounding mental health is oftentimes limited to informing and encouraging individuals to take care of themselves, access mental health services. But I feel like there's may kulang pa dun eh. It's like while these messages are indeed helpful, they only really help those who have the money, like we discussed a while ago, and the time to take care of their own mental health. And not everyone has the luxury of having that, and they don't exactly access the inaccessibility of mental health services to many Filipinos in the first place. And with that in mind, how can we and our viewers really change our mindsets? Because it's, for as the way I see it right now, it's rather individualistic the way things are being handled right now, especially within our own circles. So how can we change our mindsets regarding mental health to be more inclusive of those with less resources?
Siguro, I'm gonna start off by, and this is a call of a lot of mental health advocates na I remember it's reading a editorial written by Eva Jane Lopez and Maurice Metalmark, and the quote goes, "There is no health without mental health." And how is it important? Understanding that mental health is not a smaller part of the pie of what is health. It is an integral part of the pie. And ang hirap kasi, di ba, parang it's not visible, it's invisible, it's unseen, it's messy to deal with, it's not easy to address kasi walang magic, there's no magic gamot na pag uminom ka nitong gamot, wala ka ng mental problems. Pero understanding it as an integral part of health just acknowledges that, as with any other parts of health, it affects every single individual out here. And the quote that parang I kind of my own mantra in my advocacy has really been, we often talk about there is no health without mental health, and mental is in everyone. But if it's in everyone, then shouldn't be found everywhere everyone is. And the reality is it's not right now. And it's not just the Philippines. It's really around the world. One of the lowest funded aspects of health in terms of especially in terms of its impact. And in the Philippines, dito, parang a lot of things need to change in the mindset. Lalo nga na we started off really with basically no law at all. Now we have a law, pero now I think licensure for psychologists only started around 2013, 2014, mga that time lang. So I think I was just graduating from college. So wala pa nga tang isang dekada na nag-board exam tayo for mental health. And people are only discovering that, mental health can be a sustainable career. At the same time, mental health is not as simple as go to therapy. Kasi yung usapang mental health needs to happen on the ground, it needs to happen at Congress, it needs to happen where decisions are made. Because, di ba, parang, again, while mental health services on how it is helpful, we're barely scratching the surface. And this is why parang I also got into the more public health side of mental health kasi kasi sabi, poverty is an impact bearer is worsens risk factors for mental health. Ang daming bagay, like drug war affects mental health. Ang laking issue niyan. We've had a community-based resource for low risk or low use or mid use drug dependent individuals or drug users. I don't want to call them drug users. But basically those that are affected by the drug war specifically, they had something to turn to. And that's been helpful. It's been, I think, rolled out in some LGUs na. And we just really need more of that. Pero at the same time, we need also not to worsen the situation. The pandemic it's a global thing. It couldn't be helped. But at the same time, are we responding in a way that we also think about mental health? And there's a common discussion I've had with people on why we should have a roadmap or a scorecard. Because people need to have a sense of agency over how this pandemic is going. We need to know, let's say, and I'm going to compare us to the UK, and I know this is an unfair comparison, pero I remember because I'm with UK health professionals a lot right now, and they showed me yung scorecard yung timeline in the UK. It was mid-Feb, I remember, and they had a 2-week schedule up until June and February. So every 2 weeks, if you hit this number of, let's say, cases, hospital occupancy, vaccination rate, we will turn to this. This will be the next step. And then the next step and the next step. And if we revert back to a certain level, we will go back to this step. So we know that if we do everything well, we will be able to go out, dine in by July. Sarado pa yung mga services, that's fine, pero at least for the most part, we're gonna have a sense of normalcy again. And I, as an individual, can do something about that dahil my numbers will count. As long as I don't get sick, I get myself vaccinated, I can help work towards this number. And nato kasi just this week, nag-boss sila ng mga bar nila ng mga pubs nila. And, di ba, parang yun yung dream na, sana all. And we know that, no, they're not all the clear, pero you know that you see a difference. And another counterexample will be New Zealand. I've had friends in New Zealand who have been normal since June of last year. As in, nag-steak night sila and everything. Ako parang, I can say, sana all. Sana Thailand. Pero, you also get to understand, of course, they're dealing with something different. And these are, again, these research factors we're talking about. Poverty, good governance, things like this. They have the policies in place to support them. So, ito lang eh. Siguro no, one other change in mindset that siguro our viewers and can help really push is understanding mental health is not an individual response. And I think the best thing that happened in the pandemic for me in this specific manner is seeing friends ask me for support to help set up their own support groups. Like may barkada sila, we want to make it more of a mental support group kind of thing dahil everyone's dealing with it. Can you as a professional help safety net? Pwedeng sumalo sa amin dahil di namin alam ginagawa namin. I'm like, sure. Kasi it's taking agency eh. Kasi nga diba, the problem with self-care is kung self-care lang lagi ang babatayan mo, nakatali ka sa anumang resources na meron ka lang as an individual, as yourself. And these resources could be your resiliency as an individual, it could be your emotional stamina, your emotional strength. It could also just be your literal resources, as in pera mo, anumang physical resource that you're around, because that helps. Pero pag hindi na enough, paano na? So now you rely on community. And diba, your UP, malapit sa maginhawa, community pantries, amazing thing. And people ask me, AJ, why do you think people volunteer all the time? Kasi nga, sometimes it just feels good to help out. Pag kaya mong mag-help out in any way you can, maybe you can't listen to someone's mental health rants or mental health concerns yourself kasi you're struggling with your own. Pero, parang diba, anything that could help, helps. And that's a mindset that we should never forget. Dahil as long as we're not creating harm and as long as we're doing everything we can to reduce any possible negative impact that we have on someone, any kind of help could help. And this is something for individuals. If you're like an organization or a government, ibang usapan na yan. Dahil at that point, you should be wearing the hat of how can we now maximize things. Because if you have the resources, if we have the knowledge or the expertise to do so, now how can we make it effective? How can we make it sustainable? Dahil ang impact ng mental health during this pandemic will stay with us for a while, even after the pandemic. And that's, again, one of the kind of untold challenges of dealing with mental health, na sometimes it doesn't hit you right away. But it just means that we have to strengthen our systems, our policies more, because we have to make sure that people aren't falling through the cracks. Na ngayon, nagbabayanihan tayo for basic services, ganyan-ganyan. We don't want to get to a point na magbabayanihan na naman tayo ulit for mental health. Kasi ganun karami na kailangan. Kasi nakapagod. And diba, this is why we have systems, we have policies, we have governments, we have organizations, because part of their role is to help us in these kind of bigger picture ways. Kasi they have the money, they have the resources, they have the expertise to do so.
So, yun, it's very important to know our role, recognize what we need to do, what we have to do as part of the pandemic, as part of helping out those who have mental health, helping out the landscape of mental health in the Philippines in general, as individuals, as organizations. We all have something to do, and we should all know what we need to do. And there, dyan po nagtatapos yung talakayan natin hinggil sa kasalukuyang estado ng mental health sa bansa. So, for me, I think something that was very interesting. Well, actually, the whole discussion was very, very interesting. Thank you, AJ. But one thing, I guess, that hit me was actually the latter part where we tried looking at it from a different lens, where of course, we have our own ways of coping with our own mental health, but we also have to be very inclusive of those who don't really have access to that, because we're all part of the Philippines. We're all lahat tayo kababayan. So it's very important to recognize our role, not even just as individuals, but also part of the community.
Yeah.
What about you, Gail? Ano yung tumatak sa'yo?
Sa akin, what really hit me was yung dahil nga we are an Asian, a Filipino culture, hindi natin masyadong napapansin kung ano ba talaga yung dapat na mental health things na dapat nating binibigyang light and binibigyang importansya. I think I would also research more and help others then in my family. More importantly, di ba? So, we all have to support each other. Ika nga dun sa latter part ng sinabi ni AJ. Ayun.
Pero gusto ko lang idagdag nun, as an example dito na, yung pakiramdam na 'pag na-busy o kaibigan mo, prof mo, or magulang mo, tapos naapektuhan kayo, that's a perfect reason, for example, why you need to support everyone. Dahil if one of us is affected, then it can affect other people too.
Yeah.
And diba, parang it's not like it's contagious. It's not that. It's more of it's so it's so easy to be affected by by hard things right now because things are hard. And making sure that everyone is full, everyone is safe, and everyone is doing well as they could given the circumstances. It's just really helpful for everyone in the long run. Dahil, diba, parang even for our selfish reason of we don't want to 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 have to deal with these kinds of issues for other people. I think the best way you can do is just really be kind and be compassionate and find ways that you can support them bago pa lumala ang problema o bago pa talaga magka-problema. Because we don't need to wait for people to be depressed, be anxious to help with their mental health. Like we can do it even if we're happy, 'di ba? Parang mental health, helping with mental health isn't just pagka down ka na. And I think this is one of the things that mental health talks and people often feel na pag-usapang mental health ang bigat, ang lalim, ang sad minsan. Pero you can talk about mental health when you're happy. Is that we don't often do kasi nga we don't often feel the need to. But you could be supportive, you could diba? Parang what's the downside of making people feel welcome, understood, loved? Diba? I don't think there is. So, diba? We can also put that lens now, we can be preventive. Especially within our own circles. Kasi we can start. Yung mga nasa paligid natin.
Yun, maraming salamat po sa inyo para sa isang makabuluhang diskusyon hinggil sa kasalukuyang estado ng mental health sa ating bansa. Bilang pasasalamat sa inyong paglalaan ng oras para sa podcast na ito, ginagawad namin sa inyo ang sertipiko ng pagkikilala nito.
And the certificate of recognition is awarded to Mr. AJ Sonlao for sharing their invaluable expertise as a resource speaker for hard times, mental health situation, and PH amidst the pandemic. Episode 4 of the video podcast series entitled Pahinging Pahinga, given the 17th day of April 2021 during the pre-recorded event via Zoom. Signed by Sean Rom, Project Head, Russell Co, Externals Committee Member, Gail Estremado, Team Coordinator, and John Pelayo, Team Coordinator.
Thank you guys.
And thank you so much, AJ. Before anything, would you like to plug anything before we wrap things up?
Siguro kung may plug naman ako is nga, parang just the likes of pages of Tilakbo PH, Wife for MH, MHTH, MH Awareness, and just all these groups that are doing now good work to support mental health. Kasi right now, the reality is, yes, there are access points to mental health na wala dati ng bago, but at the same time, don't wait for your mental health to really dip before you ask for support. And if you feel like you're in a toxic home environment, or you feel like your friends can't really be the ones to help you out, understand that there are groups, kahit dito professional, there's support groups, there are volunteer groups that are working right now to really bring this support in. And actually, nakakatawa ngayon kasi two of the groups I'm part of, one is PMHA, Philippine Mental Association, are asking for volunteers. Kasi nga they're gonna be opening up their their pro bono services again. Dahil nga, ganun kalaki yung surge. I won't say surge, pero ganun kalaki yung need ngayon for mental health services. So, you know.
All right. So thank you so much, AJ. We learned so much. So thank you for coming here to the podcast. And doon nagtatapos yung ika-4 at huling episode ng Pahinging Pahinga, isang serye ng mental health video podcast na nagtanais makatulong sa mga nakakaranas ng mental health stress ngayong pandemya.
Ang episode na ito ay hinahandog ng Power of Team 6, isang inisyatibo ng Rise for Education Alliance, UP Diliman. This episode is co-presented by Sinagdiwa Volunteers for Mental Health, Mental Health Awareness, and Changemakers Philippines.
And of course, we can't forget it was created in cooperation with We Mind PH, Alliance of Public Health Advocates, City of Mandaluyong Science High School Supreme Student Government, the Philippine School, Dubai Senior High School Student Council, Yugto Philippines, Likas Bayan Organization Incorporated, and of course, ang PH.
And special thanks to Aksyon ng Kabataan Organisasyon.
And don't forget, Kaakibat, nang layunin namin matugunan ang mga suliraning may kinalaman sa mental health, kabilang sa mga benepisyaryo ng podcast na ito ay Youth for Mental Health Coalition. Ang Youth for Mental Health Coalition ay samahan ng mga organisasyong estudyante at kabataan na naghahangad na rin ang kamalayan ng bansa sa mga isyung pang mental health. Ang unang SEC-registered na non-profit organisasyong pang mental health sa Pilipinas, malawak ang sakop ng kanilang nagawa laban sa krisis at stigma ng mental health. Kagaya nung tumulong sila sa pagtitipon ng suporta at sa paglilikha mismo ng Philippine Mental Health Act.
Para makatulong sa kanilang mga programa tulad ng educational discussions, forums, at pag-institutionalize ng usaping mental health sa lipunan, maaaring magbigay ng donasyon sa GCash account ni Hazel Grace Romero na may numerong 0995-465-6448 o di kaya sa kanyang BPI account na merong numerong 981-941-3131. Tatanggap lang kami ng mga donasyon hanggang sa 2 ng Mayo 2021. Ang mga numerong nabanggit ay makikita sa inyong mga screen.
And don't forget to donate, guys. And before we wrap things up, I think, Gail, may gusto ko bang i-plug or sa mga socials natin? If you guys wanna keep up with our shenanigans, you can follow Gail on
Gail Esclamado on all platforms, IG, Twitter, TikTok, etc.
And for me naman, you can follow me on Instagram at riffraffraff. That is RIFFROFFRAFF.
Yeah.
Doon, tapos na tayo. So muli, ako si Rafi.
And ako naman po si Gail.
At pinapaalalahanan namin na kahit sino ka man,
Kapag pagod ka na, okay lang humingi ng pahinga.